This video summarises a randomised controlled trial led by Hinman titled Telerehabilitation Consultations with a Physiotherapist for Chronic Knee Pain versus In-Person Consultations in Australia, the PEAK non-inferiority randomised controlled trial. Video conferencing is preferred over telephone consultations for the provision of telerehabilitation by people with chronic lower limb pain and physiotherapists. However, a 2023 systematic review identified only 4 RCTs with 352 total participants that compared video conferencing with similar in-person physiotherapy care for musculoskeletal conditions. All these participants were preparing for or had undergone joint replacement surgery. This study aimed to determine if physiotherapy video conferencing consultations were non-inferior to in-person consultations for the management of chronic knee pain. The study was a parallel group, non-inferiority, randomised controlled trial with concealed allocation. The trial was conducted across 27 primary care physiotherapy practices in regional and metropolitan Queensland and Victoria, Australia. The inclusion criteria was people aged 45 and older with activity-related knee pain for 3 months or more, no knee morning stiffness for greater than 30 minutes, knee pain most days of the previous month, average walk-in pain score of 4 points or more on a 0 to 10 numeric rating scale over the previous week, difficulty walking and climbing stairs, access to a computing device with internet, and ability to travel to the nearest trial physiotherapist if required. Main exclusion criteria included inability to speak English, arthroplasty on the affected knee, waiting for or planning for knee or hip surgery in the next 12 months, having received knee surgery, physiotherapy, or knee strengthening exercises in the previous 6 months, and self-reported inflammatory arthritis. 1-to-1 randomization of 394 participants allocated 190 to the telerehabilitation group and 204 to the in-person care control group. Both groups had 5 consultations with one of 15 physiotherapists trained to deliver standardized telerehabilitation and in-person treatment protocols over 3 months. Physiotherapists also prescribed, monitored, and progressed an individualized home-based strengthening program and activity plan. Initial consultations were scheduled for 45 minutes, with 30 minutes for follow-up consultations. Primary outcomes were knee pain and physical function at 3 months after randomization. Pain was assessed on a 0 to 10 numeric rating scale. Physical function was assessed on the 0 to 68 Western Ontario McMaster's University's Osteoarthritis Index. 383 participants completed the 3-month online questionnaire, which means only 3% of primary outcome data was lost to follow-up. Both groups reported similar improvements in pain and function from baseline to 3 months, with a mean reduction in pain of 3 points on a 0 to 10 scale and a mean increase in function of 10 points on a 0 to 68 point scale. Telerehabilitation was non-inferior for pain, with a mean difference in change scores of 0.2 points more change in pain than the in-person group, and 95% confidence interval from 0.3 points less change to 0.6 points more change. Telerehabilitation was also non-inferior for function, with a mean difference in change scores of 1.7 points more change in function than the in-person group, and a 95% confidence interval from 0.2 points less change to 3.5 points more change. There were no significant differences between groups in health-related quality of life, physical activity, self-efficacy, and adverse events at any time point, with the exception of physical activity levels at 9 months, which seemed to slightly favour the in-person group. In conclusion, this study demonstrates that telerehabilitation with a physiotherapist is non-inferior to in-person care for chronic knee pain. These results support and build on previous studies that suggest real-time rehabilitation with a physiotherapist might be as effective as in-person care for rehabilitation after joint replacement surgery. Collectively, the available evidence has ramifications for the delivery of musculoskeletal rehabilitation services and indicate that telerehabilitation training is warranted for physiotherapists.